The most reliable diagnostic test for COVID-19 is real-time reverse transcription polymerase chain reaction, or RRT-PCR. In every country, formal guidelines have been issued to clinical laboratories on conducting this test. But in Korea, these guidelines do not address common practical laboratory issues faced during the testing procedure. Thus, the COVID-19 Diagnosis Test Management Committee of the Korean CDC gathered expert opinion on various practical issues while conducting an RRT-PCR and published supplementary guidelines. These guidelines are recommendations on how to deal with the existing kit supply in Korea. For instance, using only nasopharyngeal swabs in case of a shortage of swabs or choosing flocked swabs. How to handle kit or process failures while performing the various steps of a test, such as not adding more input RNA to increase test sensitivity, or going for a retest when the internal control is not amplified. What to do when results are contradictory, such as confirming infection from a positive result for either the upper or lower respiratory tract samples when they don't concur, but when there are no clerical errors associated with the samples or the test. How to identify and reverse the effects of various types of contaminations and kit faults, such as checking for cross-contamination between PCR tubes when the result is inconclusive, and the specifics of the minimum requirements for quarantine release. To properly test and interpret the results during this COVID-19 emergency, understanding the strengths and limitations of existing RRT-PCR assays is necessary. These guidelines are expected to help clinical laboratories do just that.